For this next video, I'm going to show you how to correct a right anterior rotation of the iliosacral joint. So the most common presentation will be that approximately 80% of an anterior rotation is on the right side, with a 20% posterior compensation on the left side. So that's what we're going to correct now. So I'm going to show you two variations on this. These are muscle energy techniques, even though we can modify them into like a thrust, and a thrust would be known as a HVT, which is known as a high velocity thrust. So what we're going to do first of all is bring the patient's knee up into flexion. Now, if they have a problem with the knee, I'll show you the second alternative, okay? So just bear with me for the next couple of minutes. So from this position, what we're going to do is find, let me come on to the PSIS, so the posterior superior iliac spine. So you slowly flex the hip until you feel the PSIS going caudally, which is going this way, or posterior, okay? Posterior or inferior here. So you're going to palpate it here, and then it starts to move. Now, what I'm going to get my patient to do is, you and knee, push me away, please. So you're going to use the gluteus maximus and the hamstrings for 20% effort for 10 seconds. So the idea is it's a post-isometric relaxation of MET. After 10 seconds, relax, take a breath in. As I breathe in, I come onto the ASIS with my hand here. I palpate the PSIS, and I slowly use my hip, and I bring him into flexion whilst rotating the pelvis posteriorly. Okay? I can palpate the PSIS to make sure that it's gliding inferiorly from here. And I would hold him for a few seconds. Then I'll repeat the second time. Take a breath in, please. And then you push again. So 20% effort, give or take. So I can feel the PSIS with my fingers here. After the 10 seconds, breathe in. And on the out breath, I'm then going to bring in again posteriorly whilst palpating the PSIS. Okay? Most of the movement is coming from my hand rotating the pelvis rather than from my hip flexing his hip. Okay? So the focus is on here. Okay. For the third time, I'm going to show you the variation. If it was the third time, I would hold him for 25 seconds so the body remembers the new position. But just for the second demonstration, if they don't like it because of the knee, if you get them just to wrap the leg around you like this, okay, which is almost easier because I don't take the weight of the leg now, especially if the leg is heavy. If you get the patient to do a similar thing, you push again, please, okay? Okay, so quite straightforward. So he is pushing, activating the muscles like we said. After the 10 seconds, take a breath. Let's say this is the third time. As he breathes out, I'm going to rotate, and I can just use a little encouragement, okay? So I can literally just rock him round. It's not really a thrust. It's not really a cavitation that's going to be elicited from the joint in here, but it's still a thrusting type of motion, okay? Okay, and sometimes I feel that this works effectively for me. And then try to hold him for at least 20 to 25 seconds in that end phase position. So that would be an MET with a thrust technique to correct a right anterior rotation of the iliosacral joint.